Okay, hello, welcome back. I hope that everyone got a chance to have a little bit of conversation and meet some new faces during the break. As I mentioned, we have two other concurring sessions going on, so we might have some people coming in and out, but um, I wanted to kick off our next session, which is looking at family priorities and our identifying research outcomes that matter most. This will be an interactive voting session. So wanted to note at the beginning of it that you will need a phone or a computer to participate in the voting session, specifically for our family stakeholders. We would really like your involvement here. So if you can get ready for that, I'll give some background information first. I'm Maggie Jalowsky. I'm the research program manager with Hope for HIE, and today I'm co-hosting with Allison, who is our other staff member, and will be leading this session today for us. So I'm going to walk through some background information on the topic, talk about what we mean about outcome domains. This morning, we've already heard a bulk of information about where the research is and what it is researchers have been doing in this space. So now we're going to take it and look a little bit more specifically into outcomes, research outcomes, and these are the measurements for research studies. And then ultimately we'll jump into that voting exercise where we want to hear from all of you. We want to engage you all and learn a little bit more about what family priorities are as it relates to research and outcomes. So as we kick off this session about family priorities, it's important to understand why lived experience is so important. All of you bring such a unique insight into this space about your daily life that is currently not being captured in the data alone. So by being here, by showing up, sharing your stories and your perspectives, it helps all the researchers in the room then develop better research questions and design more relevant studies. Often research is shaped by researchers. Researchers are the ones making the decisions, but they may not understand the true impacts on the daily basis. And so opportunities like this, sessions like this, can help us align our research to be more appropriate to respond to the ways that stories and perspectives are lived across the community. So our goals today is to understand what truly matters to families in daily life. And these can be all different things. As we know, all of us have different priorities. So some topics that we expect to talk about are sleep quality, energy, support at school. What we're hoping to understand is what helps your child or your family thrive, not just thrive, but survive. So when we talk about research outcomes, we're talking about what is being measured in a research study. Outcomes are the measurable effects that change over time, and they're often the endpoints of the study. So our goal is to drive improvements in research that measures endpoints that reflect the priorities of the community. So understanding what is important and making sure that that's what our research measures. These are also called patient-centered outcomes, as they're working to measure what matters most to patients or families. An example is on the right-hand side. This is a table from one of the old important cooling studies, but we want to highlight that the primary outcome is lumping death with moderate and severe disability. The challenges that we have when these outcomes are lumped together is that there's no nuance to really understand the differences. Ultimately, researchers are making the decision that these are equal priorities. And so it's important to then think about improving our research endpoints so that they reflect the priorities of families and patients, and that we are not measuring these lumped together. So ultimately, our outcomes shape what we learn over time. These aren't just endpoints for one research study. These are shaping what we as a community understand about HIE. So what we choose to measure determines what we all understand. It specifically in research studies, we often focus on short-term outcomes or what can be measured by the end of a research project. Today's focus, we really want to move into what are these long-term realities that everyone experiences in their daily life that we need to start moving our research towards. So for HIE, our outcomes need to evolve not just into the 1 year or 2 year mark. We need to start thinking in much longer versions of what the HIE journey and how we're measuring this over time. Ultimately, without doing this, we don't have a meaningful picture of the HIE journey, and our research is just not reflective of that. So here on the right, we have a picture of an iceberg, and what is being measured currently is just the tip. So these are things like short-term outcomes, or like we heard from what we saw in the bubble diagram, motor outcomes. These are things that are heavily studied within the HIE space. However, ultimately, underneath the iceberg, we have all of these other impacts of HIE. These are the ways that HIE have impacted your child through secondary symptoms, through impacts of those symptoms, and then the way that your family is impacted as well. All of these are currently missing from our research. This is, as Danielle was describing in her presentations of other research studies, this is not about the HIE population. Instead, this is research that is done in a similar way for a different disease state. But it gives us an idea of the ways that we can start to think about lived experience and family important reported impacts and how it can start to inform better research and better outcomes. So here we see the graph on the left is symptoms, and you see all different types of symptoms that are important and should be measured for this disease state. Then you have symptom impacts, which are the ways that, again, the family and child continue to be impacted by the condition. Ultimately, in the green chart, then you have caregiver impacts. So again, all of these are ways that we can start to think about what needs to be measured so that we can understand the bigger picture of HIE. This is another graphic from the same research study. This was done with interviews across healthcare providers and caregivers. And so this is capturing what are those lived experiences, what's the distributions of the ways that people talk about their daily life and how a condition can impact that. Ultimately, what we would love to see is that in the next year or the next few years, we would have a beautiful graphic like this for HIE that represents a true reflection of all of the ways that HIE can affect a family and individual. So we want to mention why this is all important to us, and specifically why we're including this session in today, is that we're at a really exciting point. And this is that we have been working to launch an HIE registry. A registry is a tool that is used in research to measure data over a long period of time. So you may have heard of this where caregivers or individuals can go through and answer survey questions at different points, maybe 6 months intervals or annual intervals, and that data is collected over time. So Hope for HIE has partnered with CPRN and newborn brain societies to build our pilot of this registry. This is extremely exciting because we have, for the first time, clinical database from the electric medical records linked to this registry, to the caregiver reported data, so that now we can have a very clear clinical picture side by side with the data that families report. We're still in our infancy with the registry. Currently, we have 26 participants to date. However, we are in the process of applying for additional funding and expanding the registry, hopefully with the expansion beginning by this year. And part of that expansion will be to build out these caregiver surveys. So all of the information that you share today with us on what is important, what needs to be measured in the long term, will help us inform these surveys so that we can begin collecting that data. So we have a starting point for our community. And this is a way that all of your voices in this room will be impacting immediate research coming out of this session. Today's discussion is building on the steps from October, when Hope for HIE convened its first leadership summit. It was a hybrid meeting where we brought together stakeholders and families, including our board members and staff, and we began these conversations of talking about what was important to families and how these priorities might differ from others, like researchers, or what is happening in the space. From these conversations, we started to identify there are several really important domains that need to be more deeply captured in our research. This graphic looks at a summary of what type of research questions families and other community members had submitted based on their broad topics. We'll be talking more about this in the afternoon session from 4 to 6 when we get into where our research is now, what are the uncertainties, and where are our priorities. But I wanted to mention this because during this leadership summit, something that we found is that before talking about research questions and driving our research agenda, one of the most important things were how are we measuring it? What outcomes are we using? What are these endpoints in studies? Making sure that they're reflective of the priorities before we can begin to do the research that's also aligned with the priorities. So from the Leadership Summit, we had identified 6 buckets or outcome domains of importance to the community. And these, again, are looking at longer term data. So moving out of maybe the NICU, when we start to come home with the child, what are some important areas of research that need to be captured? Today, we'll be conducting a voting session to start to look across these 6 buckets. Where are our community's priorities and where are each of your individual priorities? So I'll walk through each of the examples now. The first one is health outcomes reported by the caregiver. So while these are they might be more clinical health results, they are the perception and observed by caregivers. So these are things that would often or could be missed in the electronic medical record. Things like seizures happening at home. What is the child's sleep like? Is there pain? Is there discomfort? Is there illness that's managed outside the hospital? These are all health outcomes or clinical outcomes that are being missed. The next bucket is cognitive and behavior. So this is thinking about how the child thinks, feels, regulates. What we heard from our conversations in the Leadership Summit were things like attention, focus, memory, managing meltdowns, sensory processing, anxiety are realities that impact the day-to-day of families that are often missing from the research and from what we heard in the previous session. Independence was also an important topic, how the child functions independently in daily life. This is looking at everyday skills and internal motivation areas like this, and thinking about how this, again, impacts the individual and the family. Participation is the next bucket. So how children participate and experience well-being. This can be measured in their ability to participate in sports, adaptive activities, school, social engagements. These are all ways to measure what abilities and participation could be. Care management is how the family can access and coordinate their health care. So are they satisfied with the health care they're receiving? Are they able to access all the services that they need? And then the final bucket is family impact. So looking at the caregiver and the family. This can be the mental health of the caregivers. This can be overall family burden and the economic and financial burden of HIE as well. So these, again, are the 6 buckets that then will move into the voting session. So what's our goal now? What are we trying to do in this voting session? So across these outcome domains, our goal is to try to understand what are most important. As I said, what we decide are most important, we can then work with our team of researchers to start understanding how do we measure this and how do we build this into the registry to start collecting long-term data on these domains, because currently they are not being measured in the registry. So things for all of you sitting in these seats to consider are what are the impacts on your daily life? What are these long-term importance? What are some areas of variability that maybe differ across the community that you think are really critical to measure? And then ultimately, what's not being measured? So in your experience, what are some areas that you really wanted to know more information about that there were no evidence to support? And then this is our way to start building that into our research. Some framing questions to ask all of you as you move through the priority assessment. What outcomes would you most want to improve for your family, for your child, or for yourself? What outcomes are most often overlooked? that have a huge impact? Are there any day-to-day impacts that need to be measured? And then ultimately, what do you want other families to better understand who may be sitting in these seats in 5 or 10 or 20 years? Because that's ultimately how we're going to make change, is by doing this type of research now. So this is the time now that we'll be starting the voting exercise. So I'll ask you to grab your phones or computer. You can, if you have a cell phone, you can pull up the QR code from the slides up here. Use that. You won't even need to like refresh. It will automatically refresh the page with the research, with the questions that we're voting on, and you'll be able to move through our voting session then. So as a reminder, these are the 6 outcome domains that we will be voting on. I'll explain a little bit about I'll hand it over to Allison. She'll explain a little bit about how we'll actually be conducting this voting. But first, I want to stop and see if anyone had any questions about the outcomes domains before we get started with the voting. No. Is everyone able to get connected? Any issues getting connected? Seems you guys see the screen. All right. Mm-hmm. All right. Alrighty. Okay, so the first question is just to start and just what best describes your role as a family member. And sorry, I forgot to mention one piece is that we want this to be a family priority, so we really have a good understanding of that. So we ask anyone who identifies as a family member to participate in this. Thanks.
Okay, just waiting for a few more people. Give everyone just another minute. Get the last couple in. Yeah.
Yeah, exactly. Yeah, the question is, will we wait for everyone to respond? Yes. Actually, the way that we'll do the questions after this is that you won't see the answers in live time. So you can't be jumping in based on other people's priorities as well. So we will wait until we have till the numbers slow, that we have ultimately most of the people voting, and then we'll move to the next question after. So if your screen says that you have submitted and you're waiting for the presenter, then you're good to wait. Thank you.
I think we're good. All right. So round 1 ranking. During the first series of questions, you'll be asked to rank what outcome domains are most important to you or your family. You'll select the top 1 or 2 most important items from the list. So you can select up to 2 most important. So we're going to do a practice question first. Select the top 2 most important contributors to your daily mood. Exercise, diet, sleep, sunshine, family and friends, and hobbies. I minimized it because it was taking up, it was covering. Oh, I just got out of it.
Sorry, so you can see them coming in.
Yeah.
Because I can't see them live, so just give me an
Okay.
heads up, like when you're ready.
Yeah. All right. So still got a few more coming in. Give everybody another few seconds. All right, it looks like answers are slowing down. So our top two, oh, sleep and family and friends.
So for the actual outcome domains, like I said, you won't be able to. We just moved forward a little bit too quickly. So it's a learning process for us too. Um, but ultimately, did anyone have any questions? Is it easy enough to select the ones you want? Okay. Let us know if there's any issues that pop up and we can try to troubleshoot that.
All right, so the real round one. Ranking 6 outcome domains. So remember, you're going to select the top 2 most important to you or your family. All right. So, top 2 health outcomes, cognition and behavior, independence, participation, care management, and family impacts. Mhm. Top 2 priorities. Participation in
Participation is ability to participate in sports, school, social. So maybe I can go back and of each of them again. Yeah, happy to. Sorry, hold on one second. Let me pull that up.
yes. So for the person impacted with HIE and their family.
Yeah, I think that's a great question though. And it's something that we do want to note is for this registry, they are caregiver reported surveys. And there is obviously a difference then between the child and important priorities of the child or of the person living with HIE versus the caregiver. Ultimately, at this stage where we're at in the research, and because these surveys will be used in families of beginning at birth and in those early years, these will ultimately align with caregiver priorities. But we recognize this as a gap and something that we will continue to work on in the future. Something that we're thinking about in the registry expansion work and as we continue to improve with these surveys is how can we collect more adults or early teens and do these same type sessions with them and have a better understanding of as the journey of HIE moves as well. So yes, I think it's appropriate to answer if you're a caregiver, it's appropriate to answer for your own priorities. Sorry, I wanted to go back to the definitions a little bit. So again, health outcomes are those observations or perceived health changes from the perspective of the parent. So this might be sleep or child's pain or illness that's being managed outside the house, again, reported by the caregiver. Cognition and behavior is how the child thinks, feels, regulates. This might be attention, focus, memory, again, from your perspective as a caregiver. Independence is how the child functions in everyday life skills or other internal motivations. Participation is ability to participate in sports, activities, school, social. This might be educational attainment as well. Care management is coordinating healthcare, and then family impact is how the family overall is impacted. That might be financially, mental health, quality of life, areas like that. Okay.
Four more people, but we can. All right. Do you need time? Okay. All right. Yep. So the top health reported was health outcomes, followed by cognition, independence, family impacts, participation, then care management. But as we can see, the last 4 are kind of only a vote or 2 apart. So priority is definitely health outcomes and cognition and behavior. So next, we're going to select the next two most important OK domain outcomes. So it's almost like process of elimination. So the first two we're going to pull off because they got the most votes. Now we're going to go down to the next four: independence, participation, care management, and family impacts. So by the end of this, we'll be ranking them all in order of importance for everybody. Give it another few seconds. We're waiting on roughly 10 people. Ready? All right, let's see. So as we can see, this one is much closer, with top priority of participation, followed by independence, family impacts, then care management. But as we can see, they are, especially the three, are very cutthroat numbers there. All right, now to the last one. Select out of these two options, the one most important. So
Yeah, how your ability to manage healthcare, if you have challenges coordinating the care that you need, that you feel like you have access to quality care.
and then the other option is family impacts. I mean, and obviously we all know that these 6 domains were identified at the leadership summit, so they are all most important to all of our community, but just trying to rank them in order. Right. Looks like the numbers have slowed down coming in. All right, so family impacts with 31 and care management with 16. All right, so round 2, weighting these scores. During the next series of questions, you'll be asked to weight the relative importance of one outcome compared to the outcome just below it. For each question, you'll be asked, how much more important is outcome 1 compared to outcome 2? You'll have a sliding scale. 0% is they're equally as important. 50% or more, we'll see on the next slide, you'll see, is that the question is more important than the other question. So for a practice, for your daily mood again, how much more important is sleep than exercise? So 0 would be sleep and exercise is completely equally important. And 50, sliding to the other end of the scale down here, is sleep is much more important than exercise.
So the goal of this is we recognize this is an incredibly challenging activity. Oh, no, exactly. Sorry. This is still the instruction page. We'll do the practice question next. Sorry. Sorry. Oh no, it's broken. It's good because I don't really know how to troubleshoot it too much. So I mean, it's not broken. So yeah, the goal of this is we recognize this is a really challenging exercise because these are all really important domains. So this helps us get a little bit more information. Looking at a list of 1 to 6 isn't that helpful because we don't really know, well, are 1 and 2 really closely similar or is 1 significantly more important? So now this is your opportunity to also say, if you really disagree with something, then you can say, no, they're equally important. There's no difference between them. or you can continue to express your priorities using a sliding scale. Okay.
All right, so the sliding is now open. We'll give it a minute, as this is just an exercise, just to make sure everyone can kind of figure it out. But all right. So now the real round two begins. So the results from round one puts healthcare outcomes as number one, cognition and behavior as number two, participation, then independence, family impacts, and care management. So indicate how much more important is number five compared to number six. So remember, number five is family impacts, and number six is care management. So are they equally important, or is family impacts much more important than care management? A few more people, give it another second or two. All right, it looks like we have stopped getting answers. So. All right. It's it's a little, yeah, it's just blinking at me. Yep, there it goes. All right, so kind of right in the middle almost. They're slightly less, but I would say most people think five is at least slightly more important than six. Yes.
So what you're looking at as the results from the first one, the left side, if the dot was closer to the left side, it would mean they're equally important. And the more that the dot is moved all the way over to the right means that family impacts are more important. So ultimately, the number comes a little bit close in the middle, meaning that that maybe that it is appropriate for care management to sit right behind. And ultimately, all of these results will result in, like, you can think of it as like a pie chart. So out of like 100% of a priority, how big is this slice of pie? How important is each of these impacts? So that can help you like visualize what we're going to create. Exactly. Yeah. So you had assigned points from 0 to 50. So the number is ultimately the average of that. I believe it was out of 50. Yeah.
500.
Oh, it's 500.
500.
Oh, okay.
Okay.
That's sorry.
Sorry.
So you're looking at it out of 500. Okay.
Right, so now we're indicating how much more important is number four compared to five. So number four is independence, and number five is family impacts. So how much more important is family impacts to your family than independence?
So my apologies, though. There's a mistake on this slide. So ultimately, the sliding scale would be, they're equally important, all the way to the right being number four. Independence would be the most important. Yeah, because we're asking the question, independence versus family impacts, but independence was already ranked higher. Yeah, that makes sense.
looks like answers are slowing down. All right.
Okay, so a little bit even higher across the average then. Great. I think we can move to the next one.
All right. How much more important is number 3 compared to number 4? So number 3 is participation in social emotional activities, and 4 is independence. So how much more important is participation compared to independence? Are they equal? Or it seems to be 47 is the number we keep getting. Oh, there we go. Yay. All righty.
Right in the middle.
Right in the
Oh,
middle.
yeah.
Everyone's right down the middle on
Okay.
these.
That's good. I mean, you will see by the little waves,
Yeah.
though, those are the individual votes. So we do have, discrepancies across the group, which is great. Everyone has their own priorities, but ultimately, we're coming somewhere in the middle.
And it lets you see kind of how many
Yeah,
went to
where
one way
where
or
we're
the
at with
other.
the individual votes. Okay.
Okay. So now we're on to question 2 compared to question 3. So is cognition and behavior much more important or equally important to participation? All right, any last minute submissions? All right, so this one is ranked a little more important compared to the others we've seen. So 34% kind of gives you a little guide on where everyone landed, that cognition and behavior is more important than participation. All right. And now, how much more important is question 1 compared to 2? Health outcomes versus cognition and behavior. So they're equally important to everybody, or health outcomes is much more important than cognition.
And then again, to remind everyone, these are health outcomes that are missing from traditional electronic medical records. So things that maybe your clinicians wouldn't be reporting that are happening at home, and that can be captured in caregiver reported surveys.
Give everyone another second. Any last minutes? Those are almost smack dab in the middle, equally important to people. Or, I mean, actually, one is slightly halfway
slightly
more important, but they're very close.
Yeah, I think the big takeaway from that then is if none of them were drastically from one side to the other, overall, these priorities and the ranking that we achieved across the group consensus are pretty appropriate. That we feel that there's really important ones at the top and that they're falling in line, which is great. Again, the goal of this is so that we have some actionable results so that, in the next few months after this meeting, we can start working with our research partners, looking at now, these are the important areas. How are we going to measure that? And how can we build that into the registry? Great. Go forward. So thank you all for your participation. Thank you for making an impact in this way. Again, this is just helping us align with our goals to be more family centered in the work that we're doing, and then helping all of you get hopefully the research outcomes in the future that you really want to see that are important. We would love to hear a little bit from you how difficult this was. Did we feel like this was reflective of your priorities? Were there anything that was really challenging or you really feel you disagree with? And so if anyone wants to share some experience, we would love to hear that as well. And if we want to move to lunch, that's okay. Oh, Danielle, you want to jump in? Yeah. Yeah. Here, I'll give you a microphone so you can. Thanks.
Thank you. I thought it was really hard to rank. And then you think one thing, but then when you're comparing one versus another, then I sometimes think, well, what if I actually think the other one is more important? And then I couldn't slide it. So it was not easy. There are parts of subdomains within each big group that are really important. So I don't know.
I also think that I may have rated differently at different ages. I think like when he was, because he's 4 now, I think when he was younger, different things might have been more important. And as he gets older, different things change too as well. So I think that kind of makes it a little difficult too, because when you get more into the nitty gritty, then you think about different times and you think about the future and the past. So it does make it a little more difficult.
Yeah, that's a great point. And when we were developing this session material, something I was really excited about from all the pre-surveys is the dynamic group that we had participating. So as you meet other families and the people in the room around you, you'll see that everyone is in different places in this journey, and that's hopefully helpful for us because we are capturing all of those different perspectives and then building it into the work that we do. Thanks.
The only last thing I would that just comes to mind about it is, there's such a spectrum of people with injuries, and then they have different outcomes. So, like the health outcome was CP would be different than a moderate case or whatever. So, just something to be mindful of these answers.
Anyone from the Zoom room too, if there's any chat, let us know.
Oh, I was just going to say severity, I think, is definitely something that played into that. Like, it was harder for me to rank like independence for a child with severe outcomes because they're not independent and probably won't be versus health outcomes, which are very close to our hearts.
Yeah, and these are all great points. And in future work like this, we can do better to collect demographics and really understand who is the community that's answering. Because I think too, for example, looking at what fell last was access to healthcare and the healthcare and their ability to do that. But it may be different for a different population that has different access and different realities than some of all of us in the room.
I would like to add on what you just said about severity. And I think at one point when your child is more on the more severe side, the family impact start weighing way more than independence or even participation, because you know that you're in there for the long run. So if you don't take care of yourself and your family, you're not going to make it.
Yeah, I would kind of talk about separating cognition and behavioral. For my son, is like behavioral isn't, I mean, sometimes it's an issue, but not really much of an issue. But like for me, the priority would be his cognition and how that develops even more than the physical. And so that's kind of where that prioritized. So.
Hi. Yeah, I think also too, like our daughter's 2.5. And so I feel like we're still in the early stages of this journey. And like I'm always going to prioritize like her health outcomes and her cognition and behavior, but I'm learning more and more the family impacts too. So I think it was hard to rate family impacts higher than those because you always prioritize your kids first. Thank you.
I was glad that you mentioned the healthcare access because we are from like a healthcare desert in the South. And between he and I, we just looked at each other that was a lower priority because we've been an HIE family for 12 years across 2 children. And the only thing that hasn't changed for us in our area is access to care. And so that it is part of, looking at the demographics and the diversity of what we have, because in the South, it took us 9 months to get to a GI to even have an idea of what testing we needed. We're 9 months into, failure to thrive and GI issues and just have a referral for testing. And so that for us, all the other things did make sense, but for us and the other family who's participating, she texted me and she was like, what? Care's not important? Because we all live in Mississippi and there is very little access to good quality, research-driven, outcome-driven healthcare.
Any other hands up here? David, you want to get?
I've got 2 quick things to say. First, I'll put a plug in for the dads group here coming up in a few minutes. Please join us if you're a dad or non-birthing parent. I also wanted to say, these are so neat. I've been involved with Hope for HA for about a decade now, and it's funny. There's mile marker yellow dots on the timeline here. Those of you who remain involved will see in 10 years this day and this event and this poll as a mile marker on that chart. So your input here and your insight is so, so important. And, your answer in 2 years will probably be different than your answer is today. And it might be different tomorrow, but that's the beauty of it. So remain involved. Your voice matters. We work hard to listen to the community and really push the agenda as our folks see it. And I've seen it go from theoretical, well, actually more of like a dream, to a theoretical activity and become reality. And that's what we're doing right here today. So thank you. I just wanted to say that real quick. So I didn't really have a question, but wanted to make that point. So
I think we have a few more comments in the Zoom room, so we'll bring it over here. And then, as David mentioned, we'll be moving to lunch very soon.
So Deborah, who's joining us on the Zoom chat, has said that I agree that severity of outcome can definitely affect the answers. Her child was very severely diagnosed. The families who have been doing this for a long time, teenagers and older, could also have different answers. And then Lindsay has added that she thinks that family impact perspective can also change depending on if there are siblings involved or if it's just the parents and the HIE child.
So I'm a clinician, so I'm not a parent. But I can say I didn't see, and so I wasn't paying attention to all the questions, but I didn't see anything about the financial impacts of HIE in this survey. I don't know if that would fit into this type of survey, but I hear from a lot of families in my community that they're financially devastated by the diagnosis, whether it's the NICU bills or the follow-up care that's needed, not being able to work because they have to go to all of these medical appointments, and then they're not qualifying for whatever supports are in their community. And so they're walking this fine line between having health insurance or not. And it's like this constant battle to stay afloat. I don't know that there's been a lot of great research into the financial, like family and community impacts of these injuries, but I think that would be another place to maybe consider adding to this type of a survey.
Yeah, thank you for including that. We did list it as an example of family impacts, but we recognize that like that bucket alone would be loaded with topics. And I agree. I think that it's a really important area, especially as we continue to collect data and hopefully get new treatments. And, Mike, you had mentioned the like cost effectiveness balance of advocacy and, being able to pull in all of that, we need that data. We need to really understand what is the impact, what's the financial impact, to get other stakeholders involved. So yeah, I agree. It's a really important area.
I do think it's important to mention too with that, it's very circumstantial on location based as well, based off of state, country, provider programs, different situations. Massachusetts and Mississippi are very two different places, especially when it comes to financial impact and access to health.
And we do have our global community here as well. So it's even different than when we think outside the U.S. So one more. Go ahead. Thanks.
For us, it's not a. For me, it's not a question. It's for us like the family impact has been like very important because we moved here to Boston like 10 years ago, 12. Our daughter Sol is 4 years old. So we have been struggling. We've been here alone. We have a lot of friends in here that is our family, the family that we select, right? But not having close family, not having grandparents, grandmothers, and family, and be surrounded for your own family, it's been like, for us, it's been like really hard. So we decided to move back to Spain. Not definitely, right? Laura always say like not 100%, but we need to breathe. There we go. We have to breathe and see what do we do next. Our heart is still in Boston, right? But we have to move to Madrid, to Spain, because we need that family support that we didn't have here, right? Also financial has been like also really hard, even though we are in Massachusetts or in Boston, that they help a lot, to be honest. But family for us, it was super important.
A very important priority and consideration that changes. Well, thank you all so much. Do you want to? Please, I'll hand it over to Danielle, the PI on the registry. She'll give us the direct.
Well, so this was a super informative conversation, and even though this voting session was super hard, and I don't know, Maggie, our team is going to have to sit down and think really hard about what we can do with the data from this voting session. But you all need to know that this is so important and useful, because as we write grants and papers and build that medical literature of saying, this is what the community says is important. This is what people with HIE say we have to study. This is where NIH or PCORI should put their dollars to fund research to answer these questions. This voting exercise was useful to figure out that it's hard to vote and it's hard for us to figure out what are our priorities. But, I think we learned from this, and we'll think hard about how to design the next round of voting. This is not the end of this story. Maggie, maybe you want to talk about next steps of the surveys that are going to go out over the next couple months.
Yeah, I think we'll talk about that more in the afternoon session. So this is, again, just one piece of the research puzzle. We, after lunch, we'll have some support programming and other activities, but then we move back into our some research heavy topics from 4 to 6 p.m. Where we'll continue this work, and then we'll move into smaller group discussions with many of our research and clinician partners joining the conversation. And so I think maybe we'll talk more about next steps after that session, because I know, again, the food's out there waiting for us and we're ready. So